I'm Jenny Gold. I'm short. This chair is really high, so hopefully I'm not going to fall off. If I do, you can all clap for me. I'm a reporter at Kaiser Health News. I spend most of my time reporting stories for National Public Radio. Thrilled to be here with all of you guys moderating this panel. I guess we've all been introduced already, but I wanted you guys to sort of, one by one, tell us a little bit about your business model and what you guys are doing. Go ahead.
All right. I am Dr. Sarah Creighton, and I'm a co-founder, but more importantly, a dentist of Studio Dental. That's that big truck downstairs, and we are San Francisco's first dental office on wheels, delivering dental care to people at work. So we're just trying to make it easier for everybody to get to the dentist.
Do you want to talk a little bit about how you sort of came upon this idea and why you're doing it?
Yeah, so I had a traditional brick and mortar practice here in San Francisco for about 5 years. And I think so much of what Studio Dental was informed by my practice in a traditional brick and mortar. But what we saw is that people really struggled to get to the dentist. I think nobody wants to spend half a day of vacation time going to the dentist. And so if we can make it easier for people to get the service or the care that they need at work, that they're actually willing and able to come to get their care.
Great. Adam, you want to go ahead?
Sure. Hi. I don't know if this is on or not.
Can you guys hear?
Hello? No?
You want to use mine?
Sure, I'll borrow yours. Hello? Okay, that works. Hi, I'm Adam Jackson. I'm a co-founder and CEO of Dr. OnDemand. We're a large national, we operate in 45 states now, so almost completely national, virtual medical practice. So you can download our app or go to our website and create an account. Within a few minutes, you'll be video chatting with a board-certified doctor who's licensed to practice medicine in your state. And we go after non-emergency medical care issues, so cold, cough, flu, sinus, minor scrapes and bumps, and pediatric questions, things like that. Try to save you an unnecessary visit to the ER, urgent care, or long wait to get into your family doctor.
Great. Megan, go for it.
Will do. Oh, I think I might have the same microphone. All right, this is like past the hot potato. So my name is Meghan Jewitt, and I am on the founding team at Pager and head up operations there. And what we're trying to do is really bring the doctor house call back. So bringing the past back to the future. And we're a mobile marketplace, so we connect doctors and patients through a mobile app so they can have a seamless doctor's visit. And so the idea is, so let's say you're at home in bed with the flu, or your child has a fever, you're at a barbecue, somebody cuts their hand, God forbid, you can just with a tap of a button have a doctor actually come to you and treat your condition.
Great.
Yeah.
So as an audio guru, I have figured out the problem with our microphone. They were switched off.
Oh, wow.
So you guys are all breaking into a really new space here. What sorts of challenges have you faced, since you started? And some of you guys are really new, right? Like we started a couple months ago. Go ahead, Sarah, or anyone, just jump in at this point.
It's been so easy. It's such an easy business. I'll start. For us, we operate in 45, 46 states, depends on how our coverage is looking, but we have to spend a lot of time, money, and energy making sure we're adhering to every state law around establishing a doctor-patient relationship and whether you can prescribe or not and that sort of thing. So, we're a small company, not even 2 years old, and we already have in-house counsel, so that's kind of an indicator of some of the challenges we face.
Great.
Yeah, so I can speak to some of the challenges as one of the new crew. So we actually launched in May, so we're very new, and we're right now focusing on New York City. And I would say a lot of our challenges are very typical of just standard startup stuff. So building, hiring and recruiting the right people, making sure you've got a robust team in place. One of the things that we found that's so interesting about healthcare is just there's so many things you can focus on. I mean, a doctor house call, how many different directions can you take it? You could consider going into specialties. You could say, oh, we want to expand our geography very easily. So part of it has just been really wanting to stay focused on our priorities. We're also, similar to Dr. OnDemand, focused on really urgent care issues right now. basic primary care, that type of thing, and just trying to keep our eye on the ball and, and knock it out of the park, basically.
I think one of our initial struggles was can you provide legitimate care in essentially a trailer, and getting people through that process mentally, that you can not only expect good care, but maybe a superior service to what you've had previously.
Great. So this actually leads to another question. How do you ensure that you are delivering good quality of care? What would you say to people who might say only doctors or dentists who couldn't get a full-time job at a hospital or a private practice would be doing telemedicine or doing on-demand care this way?
Yeah, well, I feel like there's maybe a few different kind of interesting questions there, one of which is, how do we ensure that we have amazing doctors? And separately, how do we ensure that the doctors that we do have are delivering really top-of-the-line care? I'm a big nerd, so I'm a big fan of data, measuring, seeing my outcomes. Again, I feel like a lot of this is classic startup stuff, but we're talking to all our customers. We're, after each encounter, making sure to, I'm chatting with each of our providers to find out what was the quality of that experience, what happened. And then in addition, tracking actual outcomes metrics, doing chart reviews. So there's a lot of just processes you can put in place to ensure adequate quality of care. And I would have to imagine like a doctor on demand, for example, would do that, would do that at scale. And I'm happy to speak to our quality of our doctors as well, who I think are fabulous so far. But I'd want to maybe pass the question on a little bit more.
Well, we do probably similar to what you guys do. We've got a live feedback system at the end of every consultation. So this is the great part about a digital-enabled business like this, where, as opposed to a hospital or an urgent care, after the visit, you rate the doctor 1 to 5 stars, you leave comments, and then that's a real-time feedback system for us. So if it's anything less than 4 stars, that pops to the top of our operations center, and someone in our 24/7 call center gives the patient a call, sees what happens. We also set up a system with our medical directors where we're doing double-blind doctor-to-doctor studies, quality studies, to see how a different doctor will look at the case without the names on it and see, I would have done this differently, I would have done that differently, and that's how we, another metric for quality.
And can you guys speak a little bit to your payment models? Are you guys accepting insurance? Are you sort of integrating into the existing payment methodology, or is this a completely separate payment system where people are paying out of pocket for all of these things?
So we do a lot of out-of-pocket right now. We're at $40 per visit, which is a little bit more, a little bit less than most copays. We're very popular with the HSA and FSA crowd, which have a deductible to meet every year, so we're qualified expense for that. But we're also in deep discussions with the major and as well as many regional carriers around just having this as a covered benefit.
Do you want to answer that, either of you guys? Your
Go
payment
ahead.
model?
For the most part, we're reimbursed by traditional insurance. I think people are a little more accustomed to paying for dental services out of pocket or above and beyond their annual maximal allowances.
Yeah, and so what we're doing right now is we're out of pocket only. We're $199 per daytime visit, $299 for evening and weekends. And actually, to benchmark that relative to urgent care visits nationwide, if you look at the nationwide average, it's actually around $150 per visit. So we believe we're very competitive for the additional extra convenience of having a doctor actually come to you in your house, in your own home. And then in addition to that, we're actively working on accepting insurance right now, because we acknowledge that the U.S. healthcare consumer is used to paying for healthcare through insurance, and to be a big player, to be a part of that dialogue, you really have to be accepting insurance.
So for the past 5 years, we've been all having a national conversation about how to bend the cost curve. We are talking a lot about this. We've got the Affordable Care Act. We've got lots of implementation happening across the country in various ways. How do you guys see yourselves sort of fitting in to bending that cost curve, especially in instances where people are paying out of pocket and maybe it's adding cost to the system?
I think you can
Sorry.
use. I think you can use either mobile settings, a physical mobile studio, or technology to decrease the cost of an operation, and eventually that could be passed on to a patient. So I think in either setting there are ways to actually create savings.
Yeah, I think also all three of these models are sort of working toward reallocating resources. So, when you get a resource exactly to where someone wants it when they want it, you can now sort of use the market to tease out what prices should be. So I think the most important thing is increasing access to care, I think, and then all of these price points, I think, are lower than the establishment.
Yeah, and I really like the point around reallocating where you get care. So when I think about how people get a lot of their urgent care needs filled right now, it's extremely inefficient. So if you look at an emergency room, and depending on the estimate, the study that you look at, anywhere from 20 to 40% of emergency room visits are viewed as being able to be very effectively treated in a primary care or urgent care setting, for example. So just imagine, if we can handle more of those cases, but doing it at $199, that's so much more efficient for the system, and frankly for emergency care resources. I think all of us would rather those go to the really serious cases like a gunshot wound versus somebody, cut their finger and needs a few stitches. That just seems silly.
How about from the quality perspective? So in addition to price, we've been talking a lot about quality, sort of the triple aim of lower cost, better quality care, population health. A lot of that has to do with electronic medical records and how doctors and hospitals are sharing information, avoiding repeat tests. It seems like your patients are seeing you sort of outside that entire system. How do you make sure that the care they're getting from you guys is integrated into their overall healthcare package so that you can all be talking to each other and making sure that they are receiving the quality of care that they should be and not repeating unnecessary tests and procedures?
So I think it's an incredibly important point. We call it continuity of care is kind of the broader topic, and we designed that into the very first version of our app. So you've got almost a little mini PHR with our app. You can view a record of every visit, no matter what state you were in, what physician you spoke with. You'll see her notes. You'll see the prescription that was called in. And then we can export that record to you. We can give it to you as a PDF. You sign your HIPAA waiver. Or we can send it directly to your primary care physician, either electronically to their EMR or, unfortunately, by fax is usually how it goes. So that way, if you've got an antibiotic with us, your primary care physician will know about it next time you go see her.
And have hospitals and other doctor practices been open to that? Have they been willing to receive that version of the health record?
They sometimes insist on it. It's important for a hospital system to do a good job of completely taking care of all of you and your family's needs. And we're not meant to substitute primary care. We're an augmentation. We're just plugging the hole when you couldn't get in, when it was a 5-day wait to get into your system. So the system really wants that record back, and we built our platform to be able to transport it.
We certainly also have a basic EHR that we're using right now, and we're viewing ourselves as this very fast kind of progression where we're continuously upgrading and evolving our app right now. So I'd say we've got a basic version, and we're actively working on developing and enhancing that. That said, I feel like the question, though, is deeper around just fragmentation of EMRs in general. This is a national problem, and one of the issues we've actually had, or one of the, I guess, to your point around challenges earlier is I would love if there were great APIs with Epic and with these different charting systems. But right now we're still working on making sure that we're in negotiations with some large health systems around this to really integrate into their charting systems as well. But it's not easy right now, and it's just something that we're working through to make sure that we can create that continuity of care, which is so important down the road.
Sarah, you're in a slightly different situation. You kind of are providing the primary care for dentistry. How have you sort of worked with some of the specialists maybe when people have a more serious case?
I think what's really exciting about our mobile studios, is that they can act as that primary care vehicle, and that people come in with wisdom teeth problems, or they come in and they need a root canal, and we can act as that home base to refer to specialists. And it's become very, very easy to communicate with via these electronic health records with our specialists, and I think it's enabling a type of, you wouldn't believe it, but oftentimes specialists won't even email each other. They're still calling each other, and information's lost along the road.
How have you guys found that sort of the establishment, you guys are all totally the new kids on the block, and I imagine some of the more of the establishment, hospitals, doctors, maybe even urgent care centers see you as kind of upstarts, maybe an annoyance. How do you work with them, and what kind of pushback have you received?
So far, I actually think they view us more as opportunity, and I think hospitals and large health systems right now are really looking for ways they can differentiate, there's so much pressure, obviously, with consolidation of health systems right now, and really trying to find ways to improve the existing patient experience against other competing systems. So for them, I think they look at us and they think, oh, yummy, like this could be a really interesting group to work with. So we've actually had some very interesting discussions, and we're exploring working both with individual providers as well as with larger health systems. So, yeah.
How about you? Gotten any pushback?
I can't say pushback. I mean, we don't have a ton of conversations with urgent care centers, so I can't speak for how they see us. But there's a reason they exist, and there's a reason private equity firms are plowing more and more cash into urgent care centers. That's a booming business right now. So we like that trend for our prospects. But we want to work with the systems, and we have conversations with the top 20 systems ongoing since before we launched the company. They see us as I think your point about differentiating against each other is right. These big systems are spending tons of money on acquiring patients, and tools like this are retention, really, to make the system more valuable. You can have somebody come to your house and fix you up, or see somebody over video. That might differentiate one system over another. And we certainly don't want to displace the systems. We're not a hospital.
Do you see that in the future, that maybe some of these large consolidated hospital systems that are sort of, I think of them as octopuses, that all sort of stretch their arms in a million directions. They're buying up urgent care centers, they're buying up insurance companies. Do you think that at some point maybe they would have kind of doctor on demand wings or telehealth wings that, at some point might even be competition for you?
Sure. Some of them already do. We're certainly not the first telemedicine system. I think we're the first video-based one that works on every device with a camera, and we pride ourselves on that ubiquitous technology. And that's the reason why health systems come to us. We're not outbounded to any of them. When we asked them, why'd you call us? And they said, well, we looked at the App Store, and you guys got the best rated app, so we figured we'd see if we could use it. And that's how we're plugging in with the health system. So some will definitely try to build it on their own, and it's a big world. I think there's plenty of room for it.
Yeah, and actually to that point, in addition to telehealth, a lot of hospital systems right now actually already have home-based care units. Mm-hmm. Now, I will note that the demographics targeted are different. They tend to be a little older, it's more geriatric, what have you, but many hospital systems have found it more efficient to actually treat patients in their home environment, particularly for those chronic care needs. So, having a tool or a way to better interact with patients similar to telehealth that makes it much more efficient, much more seamless, and potentially in this case actually extends that age demographic down market a bit, would be very complementary to that.
What's the demographic of the people that are using your services? Are we talking about sort of healthy young people who are too busy to go to the doctor at this point? Or are we talking about some of the folks with the chronic care conditions that the whole country is trying to get the care for those folks and the costs of care for those folks under control?
Okay, I'll start. So we don't do any chronic care whatsoever. If someone with diabetes calls in and our physician thinks it's appropriate to treat the cold or the flu that they're calling in with, it's up to the doctor. We might do that, but if they're calling in to talk about their diabetes, we refer them back to their primary care physician and refund the money. So we're purely in the sort of primary care, urgent care space.
Yeah, same. We're really positioned right now, and in terms of our technology and what we can do operationally, we're for urgent care needs, acute care needs. Down the road, potentially with better tools, we could support that continuity of care in those chronic care conditions, but right now, it's urgent care.
Do you see a role for yourself in managing chronic care in the future, or do you just want to sort of stay out of that world?
I would love for us to be able to support people in that way down the road. I mean, it would be amazing to help manage people's diabetes with a doctor that comes to your home, or a mid-level that comes to your home. I think many patients would really appreciate that.
Yeah.
But for us right now, so much is us focusing and really making sure that we do our core product well before we start to get kind of greedy and look beyond that horizon.
Sure.
Yeah.
Where do you get your doctors and your dentists? I mean, are we talking about people who are doing this on the side? There are hospitalists or ER docs that have limited shifts, or are these people who are exclusively working for you guys?
I'll start just because it's kind of different, but our providers are dying for work. That young dentists coming out of school are looking at aged practices without any technology, and the options for them in terms of employment are very minimal. And so there's almost not a single day that passes that we don't have inbound requests for employment.
Wow. Is that the same for doctors, or are doctors more in demand?
We're experiencing the same situation. When we were in stealth, and nobody knew about us, we did a lot of outbound. Our chief medical officer was on Stanford's faculty, so our first 25 doctors happened to be Stanford people, which was a great way for us to start. Now we've got a pretty long waiting list of a couple thousand doctors across the country, and these are docs that either have their own private practice and they see us as a way to work from home a couple days and maybe even expand their practice, which we're totally happy with them doing. If you have a good experience on Dr. OnDemand, join the practice, that's fine. And then doctors sort of at the beginning of their career, they just finished residency, passed the boards, they're not so sure, they want to jump right into the crazy ER life. And then docs at the end of their career that sort of one foot into retirement, but still want to practice a couple days a week. And ours is a paperless system that is all you do is see patients. You don't mess with insurance companies or fax things to pharmacies. It's an easy way to practice from home.
Great.
And I would say our profile is very similar in terms of the physicians that have been interested and have been reaching out to us. We actually have had more physician interest than we can accommodate. So right now we're kind of capping it and allowing our kind of patient demand to continue to grow, and then we'll start growing that physician base again. But very similar, and I'd say it's that same early stage, late stage, as well as some individuals who are looking for more flexibility during. So maternity leave we've gotten some fabulous, absolutely stellar doctors from that who are kind of looking for a bit of a break between coming back full time. And then I think one other additional category, and I think, again, this is probably that startup glow, where you get just doctors who want something different. They're incredibly smart. They're the ones who are probably during med school, coding their own app in their spare time, and they really are just looking for an interesting group where they feel like they can do more and contribute more than just the pure clinical.
I imagine there might be some people out in the audience who are thinking about starting their own companies of some sort of Uber angle. What advice would you give to them?
Mine's always the same. It's get started. That the space, particularly in healthcare, is massive, and there are so many. We're just representing dentistry and urgent care up here. And then you think of the breadth of healthcare. There's room for so much innovation here.
And I think while we really aren't like Uber because we're not really a marketplace. The one similarity that we both have is, or all three of us really is, we have providers and demand, so supply and demand. And my one piece of advice would be make sure you always have more supply than demand. Always, 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 especially when you're changing consumer behavior. We're asking a lot of our consumers. We're saying, try visiting with a doctor on your iPad, having a real medical visit and a real treatment plan. And this is a serious board certified doctor. No one's ever done that before. It's still a very new thing. So if you're going to ask someone to try something new and pay for it, $40 is not a nominal fee. Make sure the doctor's there and ready to go. Make sure she's been trained properly. And it's expensive to overstaff, but you want to make sure you get every experience right the first time. So always have supply outstrip demand.
Yeah, and I would say that it's all about the patient experience. So it's easy to, with these Uber models or models that rely heavily on kind of cool technology and fancy new gear, all that stuff to get kind of caught up in that. But ultimately, it's about this interaction between the care provider, dentist, doctor, whoever, and the patient themselves, and making sure that that is really just impeccable. So much attention should go on that, and that's the really human part of the experience that's very easy to overlook.
That makes sense. How do you guys see yourself sort of interacting with the Affordable Care Act? Have you had to think about it a lot? Is that sort of something that came up in your conversations when you were launching these things? Were there a lot of hurdles?
So the Affordable Care Act, for us, it didn't make a ton of difference. I mean, there were a lot of people who didn't have insurance before that would use us and still do visit with us, no brainer, right? Now a lot of those people have gotten high deductible self-directed accounts where the first $5,000 a year comes out of them, so it's still a no-brainer to use something like our service. So, net, I think it's awesome that many more people are on insurance, but the effect on our business, I don't think has been significant.
Yeah, I mean, if anything, I feel like the Affordable Care Act really supports some of these newer, more innovative models because our models are all about being really efficient, being really cost-effective, delivering a higher quality service product, and that's something that in many ways the Affordable Care Act through, for example, these macro shifts to more high deductible health plans where consumers are taking on more of the cost burden through tighter reimbursement rates to existing providers. It just makes the market that much more competitive and that much more challenging for people to get ahead. So the more efficient you can be with your model, the more likely you are to succeed. In many ways, I view it as actually favorable to us.
Great. We've got a lot of really awesome questions coming in. So first one, how is pharmacy involved in your services, and what happens if a patient needs a medication pretty soon? Can you get that to them, or do they need to separately go to the pharmacy, or maybe someone's making a pharmacy on demand?
So I guess that one was probably directed at me. So right now our physicians do carry small volumes of medication. It's one of the main benefits you can actually do in a house call setting versus a more telemedicine setting. And huge kudos to telemedicine because I feel like it's very, very complementary. But it is something where, we don't do scheduled drugs. We don't do anything that's remotely contentious or frankly would put our providers in any danger. Safety is number one for us. But even like a common Z-Pack, something like that, when you're sick at home, when it's something you'd have to go out to the pharmacist, we do include it. And right now it is covered in the charge of the visit. And part of that philosophy is around not just a fee-for-service model where you're billing for every little line item, but it's actually saying we really want you to treat the condition itself holistically in that cost of care.
So I didn't quite understand. Does that mean you're actually bringing what the doctor thinks might be the prescription to the patient at that point?
No, I guess it's slightly different than that. I'd say our physicians are equipped. They actually have backpacks with kind of a set of gear, common equipment that you would say they could treat our scope of conditions. And in that kit, there's something like 20 commonly used medications that would treat, the 80% of cases we see. And if it's outside of that scope, that's fine. It goes to a normal script or RX and refer, to a pharmacy basically. But they are carrying essentially a setup that could handle many different commonly conditions that you would see.
It's funny when you're talking about that, it makes it sound like this is like a rural health provider in some way, or like, someone who carries all their gear on their back and is able to bring it out to all of these different folks, except for that we're talking about a totally different demographic.
New York City.
New York City. We're also talking mostly about like a kind of concierge medicine targeted at people who are really high tech and probably have disposable income. How do you bridge the gap to get people who maybe either don't have access to technology or maybe don't have a lot of extra out-of-pocket spending?
So we spend a ton of time and energy on making our user interface as simple as possible to get through. So we like to say we work on almost any device with a camera. Unfortunately, everyone says, what about BlackBerry? No, we don't have a BlackBerry app yet. Maybe someday. But for people calling up with a 5-year-old Dell, and an old webcam, we'll work on that machine. And if you can't figure out how to get it, or if your browser's too old and you need to upgrade, you call our 800 number. We've got 24/7 people standing by that will help you. If you don't know how to download something from the Google Play or iTunes store, our people will get you situated, create the account for you over the phone, and then get you right up to the point where you're looking at a doctor and then hang up. So we have that 24/7 kind of white glove service because many of our patients are not tech savvy people and need a little bit extra help.
Adam, what do you say to folks who argue that virtual medicine just isn't the same as having someone actually lay their hands on you and see you?
So in some cases, that is an accurate statement. If there's a wound that clearly needs stitches, if you need an inoculation at some point, the iPhone can't sew you back up. Maybe next year's phone will. Maybe Android will beat them to it. But that said, it's like 17 out of 20 things that people present with in an urgent care setting that are non-emergency things, that are not the bones sticking out of your leg and stuff, can be done well over video, can be done just as clinically appropriately over video. And I'm not a physician, so I won't leave my lane too much on this topic, but our chief medical officer, Dr. Basu, and his team have built over 220 video medical protocols that teach our doctors how to treat things that they're used to possibly laying a hand on someone for, how to do it effectively over video. And that includes, taking your own temperature and showing it. If we need vitals, there's a whole bunch of different ways we can get that, and looking at someone's tongue, and there's all kinds of interesting ways to do it over video and still images.
Did you want to answer either of those? I mean, I guess not the virtual one, but the first one.
Pardon me, what was the first part of that?
We don't have to go back. We can all move forward.
But the one thing I would say is I actually think that's right. And so many things like a basic cough or cold, they don't actually need to be seen unless it's more complicated. It's something that we have a similar philosophy. We encourage a triage call before our doctors actually go on site, and we incentivize and actually have a small telemedicine fee if it ends up just being an over-the-phone consult, because we don't want to add extra costs to the system. We don't want to be doing unnecessary visits, and frankly our doctors don't either. So we're very focused on a similar philosophy with that.
Great. And Sarah, obviously, again, you're the dentist in the group, so it's a little bit different, and your model is different as well. You're actually going out, and it's sort of, again, back to sort of like this throwback or sort of rural idea to the backpack doctor or the Marcus Welby, or in your case, sort of going to a rural health fair. You're going to employers right now, and you're seeing their employees, but you also have an ability for like anyone to come see you, and have you thought at all about sort of going and accepting maybe Medicaid or something and being able to go to more low-income areas?
I think what's very interesting is this model applied in it's called Denical scenario, where the cost savings of providing care in a trailer can actually be translated to high-quality care in rural areas. That's actually where mobile dentistry began, was in facilities or in rural areas where there aren't actually dentists practicing. But for us, we're concerned not just with the income of our patients, but rather their ability to be seen. And right now what we're seeing are people are so busy, San Francisco is so busy, that we're trying to bridge the gap for people who don't have time to get to the dentist.
Next question is, I'm just going to read it because I think, what's the number of downloads versus usage slash engagement?
Let's see. So I think our recent numbers are 3,000 downloads since launching in May, so that we're proud of that. And sorry, what were the rest of the questions in terms of?
What's the number of downloads versus usage? Like how many people, I think what this person's asking is, how many people are actually using it and engaging with it as opposed to just downloading your app?
Yeah, so we've had about 40 plus visits so far, but what we're seeing is an accelerating trend, which we're really excited about. The other thing is healthcare is very seasonal. I'm not sure if not everybody is used to thinking of it as a seasonal business, but especially with primary and urgent care. Basically, the summer is your low months, and then you go into the fall and you hit high season. So we're seeing this kind of accelerating trend since we launched in May, and we're really excited about providing great care and really helping people through flu shots, through inoculations, through things like that in the fall to continue to build awareness.
For us, it totally, squeeze a quick point in. It totally depends on the cohort of user, the type of user. So we'll see a trend where like a mother will hear about us either on a TV show or a news clip that featured us or on Facebook. And she'll try it out first for herself if she's got a general medical question, and she'll see if she trusts the service. And then we'll see her come back for child 1 and child 2, and then husband. And so those types of people are using it a lot more than like, the 25-year-old guy who's just going to call, one time a year probably.
I really like this question. How does Pager, but I think we can ask this generally, address both physician and patient safety issues going into a home?
So in terms of physician and patient safety issues, what I would say is, a lot of these things have actually been pioneered through groups like Airbnb and Uber, and we follow a very similar model in terms of trust and safety. So, there's geolocation, we've got credit card verification. If the appointment goes long, we follow up with the provider to make sure everything's okay. There's the initial kind of screening of the actual patient encounter itself. And then if there's any question, the provider actually will just bring a chaperone with them. So what I would say is those are all ways that we've kind of addressed trust and safety so far. But many of these concerns I remember being brought up in this kind of mobile marketplace economy have been, things that, everybody uses, well, not everybody, many people use Uber now and are very comfortable with it. It's very similar.
Right, but I guess also you've got the patient safety issue, right? Maybe I missed that answer, but patient safety is a huge problem. You could argue that in some ways you're safer in your own home than going to a hospital and potentially getting a hospital-acquired infection, but you've also got possible medical error by doctors, et cetera.
Well, I would say the question around kind of delivering effective medical care, you're going to see in every single setting. Mm-hmm. It's certainly better than going to a hospital and getting a hospital-acquired infection, so there's no question, no doubt about that. But our doctors are board certified, they're credentialed and licensed. You can actually kind of flip through and choose and see, do I want this doctor with this particular affiliation and what have you. We're tracking exactly where the patient is, exactly where the doctor is at all times. Mm-hmm. And then we have a very strictly defined scope of services. We're definitely not doing anything like a pelvic exam.
Sure.
This is very, very kind of straightforward strep test, stitches, that kind of thing. So I would say so far, it's funny, actually, when we entered into it, I remember thinking like, oh gosh, is this going to be a problem or not? So far, it's actually been probably one of the most not minor, but just an area that we actually haven't been having issues with. Wow. Because we've been thoughtful with chaperoning, because we've been thoughtful around,
That's
verification.
Great. I like this question too. Do any of your business models for more accessible care have the underserved in your roadmap? These populations struggle just as much, if not more, to make time for preventive care.
I'm not sure I fully understand the question. Are
any of you planning down the line to sort of target underserved populations as well, who also have problems with accessibility and finding time to go see a doctor, get out of work, sometimes even more trouble finding time to leave work?
I think the preventative care part at the end threw me off.
Sure.
Because they're two different things, right?
Let's scratch the preventive care except for studio dental.
So that's a core part of our offering. We have people visit us that haven't seen a doctor in 10 years because they couldn't afford it, the insurance didn't cover it, it's too far away. These are people in either underserved urban or underserved rural areas. So that's one of the reasons why we spent so much on engineering and product to make sure our service can work on any kind of device, no matter how old it is. It doesn't have to be the new iPhone or the new MacBook. So it's a big part of what we do every day.
So either of you guys want to jump in on that, or should we move on? Underserved populations? Okay. How do you handle consumer visibility of pricing of services? This seems to be a big problem with existing systems. This is actually a really good question. We spoke about this a little bit earlier. How do you guys make your prices transparent? And from what I understand, you're doing actually a better job of that than some of the major health systems.
Yeah, it's really easy. You download the app, you enter your profile, and you say you want to book a doctor, and you see our set visit fee, which is clearly posted on the site and communicated through our customer support team, of $199 or $299 for evenings and weekends, and you book it. And that's what you're charged, and there's nothing else. It's pretty great.
We have a huge book called The Price Master, and depending on who you are and what insurance you have, we'll 10x or even 100x the price of our service. Sorry, I meant 40. It's $40 no matter who you are, where you are.
I think we're faced with a little bit more of a challenge in terms of letting our patients know prior to them coming into our truck about what they're going to owe that day. And so we kind of have it in our community financial policy that before any appointment, you will have a broken down record of exactly what is being charged that day, what your insurance will pay, and what your expected copay will be before you walk in the door.
Okay, sadly, this is our last question. Can you all sort of speak maybe a little bit to this question? You're, maybe with the exception of Doctors on Demand, you're pretty new. Can you speak to some of the challenges of scaling out your businesses?
Well, gosh, I'm pretty excited that we launched. I mean, yeah, I mean, I think, honestly, actually, I think we're probably a little early for that one. Right now, I would say we're in our prototype phase. We're the most focused on making sure our business is perfect, every patient encounter is fantastic, that we have really happy patients and really happy doctors. So I think it's a little early for us to weigh in on that. But I'd say talk to us in a year, and I'd be happy to answer that.
Great.
Mm-hmm.
I think for us, the challenge, unlike these companies, is that we are limited to a physical space. And so right now we're full. We've been open for 2 months and we're full. So the next challenge is how do we continue to build out the service? But we're going to need to find more space to do that. And I think another challenge is really codifying operations for bringing in providers.
And, you know, like you said, launching is half the battle. Get the product out there, start iterating it, you know, look at, and we have 2 products, one for patients, one for doctors, and just improve those as fast as possible, and that's the most important part.
Great. Well, thank you so much. You guys were all fantastic. I'm excited to see where your businesses go.
Thank you.